This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Nexstep G Respules is an essential medication used for managing chronic obstructive pulmonary disease, COPD. It helps ease breathing difficulties and improve lung function. Indications and uses. This medication is indicated for the maintenance management of airflow obstruction in individuals diagnosed with chronic obstructive pulmonary disease, COPD, which includes chronic bronchitis and/or emphysema. By alleviating symptoms such as coughing, wheezing, and chest tightness, it plays a crucial role in enhancing the quality of life for patients suffering from this chronic condition. How it works. It functions by blocking the action of acetylcholine, resulting in bronchodilation and a relaxation of the muscles surrounding the lungs, thereby helping to reduce COPD symptoms. Directions for use. Nexstep G Respules should be used as prescribed by your physician. It is specifically designed for oral inhalation through nebulization, which utilizes a nebulizer connected to an air compressor. Patients must follow the doctor's guidance on how to properly use the nebulizer, ensuring that they do not exceed the recommended dosage. The physician will determine the appropriate dose and duration based on individual factors such as age, body weight, and overall health condition. Possible side effects. Common side effects may include shortness of breath and urinary tract infections. Patients are encouraged to contact their healthcare provider if these symptoms worsen. Precautions and warnings. Before starting treatment, it is crucial to inform the physician of any existing health conditions such as kidney disease, glaucoma, or urinary issues. Caution is advised for pregnant or breastfeeding women, and the medication is not recommended for individuals under 18 years of age. FAQs. 1. Why is this medication prescribed? It is used for managing airflow obstruction in COPD patients. 2. How should it be taken? Use it as directed by your physician through nebulization. 3. What are common side effects? The most common ones are shortness of breath and urinary tract infections. 4. What if I use more than prescribed? Consult your doctor or seek immediate medical attention. 5. Is it safe to drive after using? It does not typically affect driving ability, but consult your physician. Thank you for watching our video. If you have any questions or suggestions, please feel free to leave a comment below. Your feedback is always appreciated.